Hi, my name is Juan, and welcome to The Couch, a podcast where real therapists talk about real things. Please remember that we are therapists, but we are not your therapists, and this podcast is intended for educational purposes only. Today's podcast, if you are jumping in, it's on what is neurodivergent therapy. Have you heard of that term, neurodivergent? You know, when I was back in school, so this would have been, let's see, in the 2012, around there, grad school, get my master's and doctorate. I don't remember this term, being highlighted to the same degree as now. And I'm glad that there's a push for an emphasis for it. If you're new to the term, here's a really simple way to look at it. A neurodivergent individual is someone that experiences the world in a different way, right? There's no negative there. And I'll give you an example of that. My sister's on the spectrum, autism, and she sees the world and experiences it in a different way, interacts with it in a different way. My hope for this podcast episode is to bring some education forth. It's not going to be every single bit of data and research on this area. Instead, it's going to be a few pages, right? We're going to open up the door so that there's awareness. And maybe if you are a neurodivergent individual, or if you're a parent to one, you're going to receive some support, some guidance. We're going to break this down. We're going to explore ADHD, autism, sensory processing differences, executive functioning struggles, masking, emotional regulation, anxiety, how this shows up in relationships, which it does, looking at it through teens, through kids, partners, families, parenting, all of that. I want to welcome you back for another episode of the Couch Podcast. And I want to thank you, as always, for being a listener. Now, have you heard of these phrases? Or someone out there, maybe you or someone out there. I think I have ADHD. My kid struggles with sensory overload. I've always felt a bit different socially. Or I get overwhelmed easily. A neurodivergent individual, they see the world, they experience the world differently. And I think because of that, when myself, as someone with ADHD, right, I'm a neurodivergent individual, when I'm in school, it was a different experience for me in school. I mean, I will tell you that I would study my ass off and show up, and you would go, Juan, so, let's look at this math problem right here. What's 6 plus 6? And I would go, oh, you know what? 11. Now, you're laughing at me. It's fine. A little humor in life can go a long way. Look, I would study my butt off. It just wouldn't click. It wouldn't click. It wasn't my cup of tea. It wasn't until later, I started to realize that with ADHD, there's a stronger definition that brings out what's called executive functioning. And one of my domains there, my ability to retain information, it was just really struggling. I hadn't matured enough to understand that because I see the world differently, because I interact with it differently, that means that the way Timmy next to me studies and shows up in class is different than how I needed to show up in class. All right, so let's keep going. What does neurodivergent actually mean? And more importantly, right, what does therapy look like for someone that's showing up for that? Let's unpack it a bit. Let's look at that together. So neurodivergent is a term used to describe, right, and you're going to guess it, I've already shared it like 5 or 6 times, right, the brain sees and processes things differently. When I say things, I'm talking about information, right, emotions, social interactions, sensory experiences, than a typical person. Now, I'm going to go through that list again, right? This individual, a neurodivergent individual, whether it's you, your child, your partner, your parent, their brain processes information, comma, emotions, comma, bunch of commas here, attention, social interaction, sensory experiences, social situations differently. Right? Even sensory. Like I will have that. My daughter is the same way as me. She'll put a shirt on, take it off, and go, "Oh, this doesn't feel right." And then my brother looks at her, and they're like, "What? What do you mean it doesn't feel right?" Yeah, there's something off with it. And I'm like, "I get it, girl. I get it." There's something about like the material, the texture. And if you're listening to this and you're understanding that sensory experience, right? Aha, there it is, a neurodivergent experience, right? It's how we process and see an experience. Common forms, right? So let's look at these. What are these forms of neurodivergence? Right, so there's a few of them. ADHD, autism, dyslexia, OCD, sensory processing differences, Tourette syndrome, learning disabilities, and some forms of anxiety. Also, giftedness is in there, right? Now, when we talk about this, right, let's look at the goal of neurodivergent therapy. It's not to bring, let's say if I'm the client, it's not to bring me into therapy and say, Juan, you got to be more normal, No, fuck that, right? It's not to do that. Love yourself, appreciate yourself. It's not to do that. It's to create a space for that person, to say, hey, look, let's understand what's happening. Let's reduce shame. Let's improve performance and functioning in different categories. Let's strengthen relationships with yourself, with others. Let's look at managing stress and managing emotional overwhelm. Right? That's where the goals can really be nestled in, not in telling someone that they need to become someone else. Right? That can create a lot of pain, a lot of shame, a lot of hurt. Really, when myself as a counselor working with someone within the lens of neurodivergent therapy, it's not a huge difference as far as like, fireworks going off in the room. They're coming in. It's a no judgment zone. It's supportive. Really what's happening is I'm aware of things a little bit differently. So for instance, in traditional therapy, I may have someone that doesn't identify as a neurodivergent individual. So there may be less eye contact, right? There may be less sitting still. That person at some point may go, Dr. Santos, you've been speaking for like 2 minutes and I lost you at 45 seconds. Right? So then we talk a little bit about that, and then they share with me, the need to have some pauses, maybe a few words, and we stop. So that can go into like verbal processing. Could be a little bit easier, a little bit harder. Right? So these are some ways there. With traditional therapy, sometimes we could assume certain things, such as, let's say, social skills, right? The person should have social skills. We may assume that in a traditional therapy. Emotional expression can look the same for many people in traditional therapy, right? And this is outside of a neurodivergent individual. Now, if I have a neurodivergent individual, they may show up and process even the emotions that we're going through differently. It could be grief. I remember working with this amazing individual, and we were in the woods of grief, and this person said, is it okay for me to feel sad? Right? So they're really looking at the term and exploring it. And then we dove into that together versus maybe someone on that other end, right? And non-neurodivergent individual, they're jumping right into the grief. And again, just really how they process and see. I find that with neurodivergent therapy, something that has really strengthened the work is creating a collaborative relationship, getting to know the individual, working to see the world as best as I can in the ways that they share it with me and how they're seeing it. If you're a parent listening, you may find this helpful. Here's some things that I see in kids, right? Children often come to therapy I think because of parents, right? Parents see something, or because the school sees something. And what they see could be a meltdown, maybe trouble following routines, maybe big emotions, right? 0 to 100. Maybe they're having a hard time going to school, or a downright refusal to go to school. And some of these kids, right, they may appear extremely energetic, or maybe very quiet, maybe distant, rigid. Parents may say, teachers say they're fine at school, but, Juan, at home, it's a whole different story. Right, so these are sharing with you, these are some common signs that I'll see in kids that may fall into this category of a neurodivergent individual. Now, I shared with you these symptoms, right, of an emotional meltdown. And what we may see in the child is we may see that they have these highs and lows. Now, for a teen, right, still in this category of neurodivergent individual, teen individual may struggle with identity confusion. They may struggle with burnout, academic pressure, and they may internalize that for a good minute, months, years. And then they may internalize, what other people are saying to them, like, you're lazy, you're too sensitive, you're overreacting. But in reality, it's the struggle of, having to figure out how to deal with these social interactions, having to figure out how to manage big emotions, burnout, masking. Maybe they've been having, and literally like a mask, pretending to be someone else, pretending to sit still in class, pretending to say things to people because they know people want to say it, even though they feel disconnected. Therapy, for kids, for teens, I think one of the beautiful things about it when your child is in the space of a neurodivergent individual is therapy can really support them to understand their brain. I mean, imagine that for you. You're listening to this podcast. What if someone at some point set you down and said, let me tell you about your brain and why sometimes you feel this and experience that? I mean, shit. Please, rewind the clock. Take me back. I have many experiences as a kid that would have loved someone to show up and provided some gold nuggets there. Therapy early on can help kids and teens reduce that shame, the shame of, why am I not like that kid next to me? It can help them learn regulation skills of those big emotions, build confidence, right? For adults, some common signs of neurodivergent behavior, symptoms, items that we could see. Common adult concerns can include an adult saying that they're having relationship issues. At Santos Counseling, I work with a lot of couples, and at times when working with a couple, we uncovered this area and we go, you know what, this is ADHD showing up in your relationship. It could be the adult says that they just feel different about an experience, and the other partner goes, well, I feel this way, and they just struggle to kind of see each other in those experiences. It could be social fatigue, sensory overload, burnout, chronic overwhelm, a hard time being organized. I mean, that one really connects to ADHD. And some adults, I'll tell you something, some adults discover neurodivergence later, right? Later in adulthood, they discover it. They come in, they tell me, wow, talking about these things, I realized as a kid I had these signs. So if any of these signs really stuck out to you, know that there's support. Know that there's support.